Allegiance by Mr. Lott. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome to the January 19th meeting of County Council. Can I have a roll call, please, Ms. Zimbo?
Mr. Brown.
Here.
Mr. Kuzic.
Present.
Mr. Giovanni.
Here.
Mr. Gofredo.
Here.
Mr. Heckman.
Here.
Mr. Lott.
Here.
Mr. Myers.
Here.
Ms. Fargo Hefner. Here. Ms. Zirinsky. Here. All present.
Before we move on, I'm going to turn over to Mr. Spadoni. He has something he wants to say.
I was alerted this morning in reference to the agenda, and I've looked at this through the Sunshine Act, and it is clear that we may not take official action this evening. I communicated that to the staff earlier today, and I understand that was conveyed to the county executive suite as well. So we will proceed in that fashion, and all votes will be at the first meeting in February. Thank you.
With that said, approval for minutes of January 5. We can't do it, so we're going to move on to the courtesy of the floor. There's no one who has signed up. If there's anybody who would like to speak, you can come up, sign in, and let us know who you are. If not, the county exec, Mr. McClure.
Thank you, Mr. President. Recently, we've read that the Lehigh Valley has been ranked as one of the best places to retire. We knew it was a great place to live, work, and raise your family, but now we know it's also one of the best places in the country to retire. And to that end, we wanted to talk about how age-friendly we are and why we are so age-friendly. Because our population, our median age, is rising, and it's very important that we be age-friendly in Northampton County. And, you know, across our county government, we do important things. We run our senior centers, for example, across the width and breadth of the county. Our area agency on aging protects our seniors. We run a home heating program that helps you as a senior if you are running low on your fuel and can't afford your fuel. There are so many things we do. We have over 300 miles of trails and waterways, and we're trying to make them as accessible to folks who have disabilities as we possibly can, including our aging population. We're really age-friendly. And to that end, I want to share some of my time in County Executive Report with Ms. Carmen Bell and Becky Bradley. And Ms. Bell's going to explain to us how it is that we're age-friendly and what are some of the things we can do moving forward to do that. Carmen?
Thank you, County Executive. Thank you, County Commissioners, for having me here today. We so appreciate the fact that you are interested in the age-friendly agenda and that you are supportive of the work that we're trying to do to create and improve upon an inclusive, engaged, respected community that provides a good quality of life for all of its residents, but particularly those who are aging and wish to age in place. And age-friendly Lehigh Valley means that we work to provide resources and opportunities for all of the residents to be able to live a good life, to be connected to their community, to be valued for the wisdom that they still have to share with us, and to also make sure that when they need it and if they need it, that we can provide them with the attention and services that they require. We joined the Lehigh Valley joined the Age-Friendly Network. We wrote a plan that describes how age-friendly we are and the things that we're going to do to improve upon the things that are already here, and the county executive has been extremely helpful and supportive in that agenda. Myself, including my counterpart Becky Bradley at the Lehigh Valley Planning Commission and AARPA, under the auspices of the World Health Organization, allowed us to be included in the age-friendly network of livable communities. We wrote the plan. The plan was accepted and accredited, and now we are official members of that livable network. That provides us access to resources and information about how we can help improve the lives of all of the residents in Northampton County. So we're very, very appreciative of the support of the county executive and all of the county commissioners.
I think Becky has a word to say.
Sure. So I just wanted to thank the county executive and all of you, because your investments in our aging population make a huge difference every day. On top of it is you have adopted Future LV, the regional plan, which is the county comprehensive plan, and that served as a basis for the work that Carmen's been leading through the United Way. And one other thing you should know too is Carmen and I both serve on the AARP Pennsylvania Council. So we get a chance through your work and your support to be able to actually be an example for the whole Commonwealth of Pennsylvania. And because of the association with World Health Organization, I really think that this is a national leadership opportunity for Northampton County. Your investments from the parks, rec, and open space components to everything you're doing on housing supports the age-friendly agenda. And bringing that together as partners is a huge deal, and I just wanted to thank all of you for that.
Mr. President, since it's a presentation, can I ask Ms. Bradley a question? I'm just curious.
You sure can.
For information. No, it's a lot. My reputation far exceeds my ability to be that mean. My thing is, I was curious, for years and years, I served on the Alliance for Aging. That's now part and parcel of the United Way. And either one, are you working with them? Because I know a great deal of work, especially in the medical end of our area, we did for years, and I hope that all these groups are sharing information.
For sure. So the Alliance for Aging started about 20 some odd years ago, really geared in protecting and championing the rights of our older adults. And then we decided that we could further that movement by joining the community of livable communities. And so we transitioned the Alliance on Aging into the Age-Friendly Lehigh Valley Steering Committee and Network. So we built where we are now based on what was started by you and other people 20, 30 years before. So that work continues.
I was just curious because I'm glad you're all working together. Thank you.
And if you want to explain what we have here.
Sure. So this certificate that I'm about to present to the county executive and to all of you is the official recognition from AARP and the World Health Organization that Northampton County is an age-friendly community, a livable community, and is certified as such.
Thank you.
Well, thank you for this. Thank you so much.
Appreciate it. Thank you.
Thank you, Becky. Thank you so much. Let's get a picture with Carmen. Come on. Make sure you get counsel in that, Becky. Thanks.
Thank you.
With that said, we thank you for all the work that you've done on behalf of all of us seniors up here.
Oh, I can't see now. May I continue my report, sir?
You most certainly can.
So we spent a lot of time at our last meeting talking about the Partnership Health Center, and I think I have more information that it's important to convey to council with respect to the establishment of a Partnership Health Center in Northampton County. We have received correspondence from SEIU 668. These are the folks who represent our human services workers, our workers in children and youth, our workers in aging, and our workers throughout, our unionized workers throughout our human services building on Emmerich Boulevard. And this letter is dated January 19th, 2023, and it is addressed to myself and to Mr. Myers, Northampton County Council President. Dear council members and County Executive Lamont McClure, as the representative of SEIU Local 668, I write to you in support of the proposed Employee Health Center. We all know that health coverage and costs are one of the largest issues in our society. Northampton County has come up with an innovative way to keep the costs under control while also providing true access to coverage for its many employees. This is anticipated to benefit taxpayers by actually lowering costs while also allowing employees to have the option of same-day appointments within the very county where they work and live. The employee survey made clear that the vast majority of employees support this option. Integrity Health is a proven provider of healthcare services for government entities looking to control costs while providing a great benefit to its employees. As usage increases, costs have gone down in other municipalities. This is a unique opportunity for Northampton County to lead in the innovation of healthcare delivery while being a good steward of the public's money. Helping keep the employees of Northampton County healthy helps everyone and is vital, especially with the sensitive work that many of our members provide for the county. Our members and all county employees would benefit from the creation of this in a multitude of ways. This is truly a win-win proposal, and I am proud to support this initiative as it's currently proposed. As stewards of the public's interest, our union understands your need to vet all proposals and ensure that taxpayer money is spent wisely. This proposal would do just that. Thank you for your consideration, and I look forward to our continued partnership in serving the residents of Northampton County. Sincerely, Christopher M. Ellis, Business Agent for SEIU Local 668. And we thank Mr. Ellis for letting us know what his members think. So now we've seen the steelworkers at Graysdale, who represent the RNs and social workers, our largest AFSCME local, 1265, and now SEIU, who represent all of the unionized workers who work in our human services building, say, we want this, and we want it now. One of the conversations that we've been having is about return on investment. And some of us have rightly asked, Mr. Gaffredo being one of them, where's the proof in the pudding? And you might recall last week, or 2 weeks ago when we were here, Mr. Heckman, in one of the questions he put to Mr. Forrester, elicited an answer about the Toms River Board of Education. And in that answer, based on Mr. Heckman's question, he indicated that Toms River had experienced 50% less increased costs compared to the state of New Jersey in the rise of its healthcare over the time that Toms River has had a partnership health center. And I believe Mr. Forrester has told us previously that actuaries were looking at the Toms River Board of Education to see what the ROI, or return on investment, was. Mr. Forrester has provided me with the executive summary of that actuarial report, which was performed by Santa Barbara Actuaries, Inc. So, we can Google them and check them out. They're in Santa Barbara, California. And there's a memo to Integrity Health. And it's from Andrew McKenzie. He's got a bunch of letters after his name, FSA, CERA, MAAA. He's got lots of letters. But here's the bottom line. Based on our analysis of utilization and claims data for 4,612 members, by the way, we have about 3,000 eligible lives. Claims data for 4,612 members eligible to use the Partnership Health Center, PHC, in 2021, we estimate that medical services provided at the Toms River Partnership Health Center would have cost $1,812,244 outside the Toms River Partnership Health Center. And prescriptions filled at the on-site pharmacy would have cost $225,383 if filled at other network pharmacies. Furthermore, we estimate that gross claims expenditures for the inpatient IP, emergency room ER, and urgent care UC services were reduced by $3,550,561 in aggregate in 2021. And remember, this is in the pandemic when people are going to the doctor less. Together, this amounts to total estimated savings of $5,558,188 and a gross return on investment of 1.33 to 1. In addition, we are reviewing data related to additional savings which may be attributable to the Green Circle program, reducing out-of-network costs via direct provider contracting. We expect that this will result in increased savings and an increased ROI. So, Mr. Forrester, when they have the full report done, has agreed to bring Dr. Valerian in to, and apparently Dr. Valerian is an expert on actuarial assessment of healthcare providers, to come in and explain the report to us and show that at least in 2021, there was a 1.33 to 1 return on investment for the Toms River Board of Health, and that massive savings that was laid out here in that executive summary. Finally, I think it's probably useful for us to be introduced to a CCAP member. He is Richard Mirabito, and he's on the phone with us. Mr. Mirabito is commencing his second term on the Board of Commissioners for the County of Lycoming. He first came to Williamsport in 1989 when he was selected to be the law clerk by the Honorable Malcolm Muir of the United States District Court for the Middle District of Pennsylvania. Additionally, for over 25 years, Mr. Mirabito has built businesses, renovating many substandard area buildings, creating jobs for residents, tax revenues for the area, and improvements to the neighborhoods. Mr. Mirabito, pardon me, Rick, was elected to three two-year terms as state representative for the 83rd District, serving from 2009 to 2014, and served on the following committees of the House of Representatives: Finance, where he was secretary, Agriculture and Rural Affairs, Commerce, Aging, and other adult services and local government. He also was a representative from the House of Representatives to the Center for Rural Pennsylvania and to the Industrial Resource Center, an agency which oversees manufacturing in the Commonwealth. Mr. Mirabito graduated Cornell University and the Boston College Law School, where he was editor-in-chief of the International and Comparative Law Review. At graduation from law school, he was honored with the prestigious Thomas More Award, presented to the one student who best exemplifies the character of the man who refused to put the king above the law. In 1997, he was selected to serve as court counsel to the Supreme Court of the Republic of Palau, a small island nation. So Mr. Mirabito was very much involved in the selection of the Partnership Health Center, and he graciously agreed to be with us tonight by phone once he realized that he would have had a 4-hour round trip if he came here in person. But Rick, can you hear me?
Yeah, I can, and thank you for that introduction.
Can we turn that up a little bit?
Are you getting feedback, or is it okay?
No, we're fine.
Okay. So one of the things, I'm in my second term as the county commissioner, and one of the things that I've kind of learned is that it's important for us as county leaders to try to share what we find works so that we don't necessarily reinvent the wheel. And I've learned this after going through all sorts of problems, as we all do, whether it's with our prisons or whether it's with healthcare or whatever. And that's one of the reasons that I, wanted to come and see you tonight or certainly talk to you by phone. When I first got elected as a commissioner, of course, one of the biggest cost drivers we had was our health care. And we had sort of made a transition. Prior commissioners before me, I always kind of look at the work we do, all of us, you folks and myself, as building on people who have come before us. And in my case, they had sort of gone through lots of experiences with the large insurers like the Blues and others, where you would every year try to struggle with what's going to be the increase in healthcare costs. And they had made a movement to Benecon, which was a cooperative. And then we began, and under my time that I was there also, to a self-funded plan. I believe that you all are self-funded. Is that correct?
Yes.
Yeah. So we were looking for ways to try to cut our healthcare costs. And in around 2017, so I can't remember where I learned of this, whether it was at CCAP or somewhere, but I heard about Integrity Health Center, and we actually, another commissioner and I, Commissioner Masser, went to tour the facility in New Jersey. We drove down. It was I think it was a pretty warm day, but they had an open house, and we went to it, and it was quite impressive in my mind because I think that part of it was we got a chance to reframe our understanding of healthcare costs. We were always looking at it as how do we keep premiums from going up? And when we met Doug Forrester, he sort of helped us to reframe the question for ourselves to maybe the question was, how do we keep employees healthy? And even though that sounds very simple, for me, it was a very profound moment because one of the things I knew about us as county employees was that people stayed a long time. We would have employees for 30 years, 20 years, and we would get reports on what our highest cost drivers were, our top 10 claims. And they were cancers and they were other serious problems that would run $800,000, $1 million in care. And they were things that we probably could have caught earlier, especially when people had been with us for so long. So I kind of had a profound moment of saying, wow, really we're too focused on the system buying healthcare as a commodity and grappling with premiums going up as opposed to how do we keep employees healthy. And then we started to have conversations about what we can do in terms of creating a healthy environment for our employees. Now, of course, some of us were thinking, geez, how do we get people to do this? And one of the things Integrity Health told us is, look, you need to make it voluntary. To give you because I know I have a limited amount of time, but to just help you understand, we have about 550 full-time employees and 250 retirees. So we had about 765 lives. I thought how many lives did you say? I thought I heard you said 3,000. Yeah. So we're saving money, and we haven't been running that long, but we are confident we're saving with 765. And I think with 3,000, you're going to save a bundle of money. I mean, I'll give you an example. Just in the area of blood tests, and this is something that I've learned because the whole process of getting involved in building the health center has been a process of educating ourselves about the whole insurance system and the way these health systems bill. If you get your blood drawn in a doctor's office, it's about $60. If you get it drawn in a hospital, it can be we can pay $600 as the insurer, because there are various rules and regulations that allow entities to charge. We began to examine, as a self-funded entity, what are our big cost drivers? Well, we knew that they were diabetes and musculoskeletal problems. And diabetes, if not treated, can lead to all sorts of serious problems. And cancers that would be treatable early on if they were detected. So what we realized is that if we found health problems in year 3, instead of year 15, which is sort of what we've been doing, because people, instead of focus on how do we keep employees healthy, we as policymakers are struggling with how do we keep that premium from going up. We also realized that instead of paying somebody to do x-rays or paying someone to do physical therapy, we could hire those people. Now, they're not county employees. They're employees of Integrity Health. So we don't have all the issues of the liability and the training and et cetera. But what we do have is we have the ability to drive down the cost of the services that we've been purchasing on the open market. When our employees under the old system went to get an x-ray done at a hospital, that hospital has to factor in all of the overhead that it needs, and then it puts it into a price tag to charge us for an x-ray. When we, during our endeavor of setting up the health center, we purchased x-ray equipment. Now, our challenge is to try to get more covered lives. So, for example, we're considering going to some of the school districts or the city of Williamsport and seeing if we can get them to participate, because the more covered lives we can push up, our cost per service goes down.
That's right.
Right? Which makes sense. So one of the things that we've been able to do now is, like, for example, in December, we just had a meeting. We have a meeting once a month. We got a report utilization. And just to highlight a couple things, we had 103 patients who were seen. 68 of them were employees and 35 were dependents. And right there, those visits, we averaged about 150 a visit. It would have cost us about $15,000 to $16,000 for those visits outside. That's a tiny bit of the cost savings, but it begins to help us understand how we can save money by basically running our own show. Here's the other thing that I really like about it. We can craft the health center to the problems we need based on what our employees need. Like I said, diabetes and musculoskeletal, you know, sometimes musculoskeletal, people end up trying to treat it with pills. And there's absolutely a ton of evidence that shows that you're never going to treat musculoskeletal problems with narcotics. What can help is physical therapy. And so under our old health system, our employees were limited to, 20 visits before they, under the health plan. Well, now it's unlimited. They can go, because the physical therapists basically are on a clock, we can send someone, if they need to go 25 or 35 times, they can go. And there isn't this pressure on the employee not to go because it's going to cost them money, which in the long run ends up not solving healthcare problems and can lead to worse problems. And there isn't pressure on the employees to have co-pays. If you go to the health center, there's no co-pay, and we don't even charge people for the pharmacy. So what we do is we encourage people to voluntarily participate. Now, what we try to do is we try to create a situation where if it's a choice between going to an outside provider or going to the health center, they choose to go to the health center. So, for example, if there's a deductible and they go to the outside provider, in the past it was subject to the deductible, and now it's subject to the deductible. If they go to the health center, there's no deductible. But let me give you an example, because we've had really incredible feedback, positive for our employees. We had and actually, I'll give you an example that's not a specific example, because we had people taking their kids there and we've gotten wonderful times. But imagine this. My kid on a Saturday is out climbing trees. It's 9 o'clock. They fall out of a tree and they've got a swollen wrist, and you don't know whether it's broken or whether it's just a sprain. So in the old days, you would go to the ER, and I don't know about your ER, but we literally, if you go to the ER, you may sit about 6 hours because you're not a crisis. You're not in a crisis, right? They have to take people who are in a crisis. So you would sit there. It's very expensive. It was a $250 copay for our employees. And you might just find out you get an x-ray done, but you walk out. We would pay a lot of money, we as a health insurer and our employees. Now they can go down to the health center because we have some weekend hours. They can get an x-ray. If it's a sprain, they can get it taken care of. And if it's broken, they can be sent to a proper place to have it set if it's not being set at that minute. But it's really us as policymakers taking control of our health system in a way that we do with a lot of other things, whether it's running the prison or whether it's running the 911 center or whatever it is that we do. We're taking control of our health care. The other thing that I like about it is there's a lot more transparency in our healthcare purchases. We pay Integrity Health a flat amount each month to manage it. They have no financial incentive to tell us to utilize this or utilize that. They scope out the cost. We put out, just like we purchase anything, we follow purchasing on the x-ray equipment. There's no hidden costs that are going to them because we're buying it directly. And what I learned is that there are a lot of hidden relationships in the healthcare industry that you and I don't really know about, especially on the pharmacy side, but just generally, and rebates and all sorts of other things that end up just not saving as many tax dollars as we could save. So that's just a little bit about it. I'm happy to take questions. I I really think that if you make it voluntary, that you're not going to go wrong, because at the end of the day, everybody wants to have a decent health care coverage at a cost that they can afford. And we've seen, since we went self-funded, a drop in our health care costs. And I'm confident that we're going to see it with Integrity Health. By the way, we did an RFP, and that was because we had a new commissioner come on. He wanted to do an RFP, so we said that's fine. What I found through the RFP, we had about 7 apply. Some of them were absolutely huge. They had 350 to 500 clients, health centers. And I found that one of the things I liked about Integrity is I thought that there was a real sense of keeping people healthy, that there was a passion about what they do that goes beyond just providing a health center. It's really about trying to help us keep people healthy and keep costs down. And, the other companies, I wasn't necessarily impressed. It was unanimous. All 3 of us felt that Integrity was a company that we wanted. And some of it, I think, is because of the size and attention. But I think some of it had to do with the passion, and also with the honesty and the ability to try to help us understand the health system and educate us. So I'm happy if you have questions to take it, or if I can, provide you with any other information.
At this point, I'll allow questions from members of the council, if there are any.
Thank you. Hi, Commissioners. Ron Heckman. Thank you for coming on. I have a question, because I did see your contract. I reviewed it. I've been doing a lot of research. And I saw that you had put it out to bid, and, and you picked Integrity, and you clarified why you did that. I was curious, though, in Lycoming County, your county seat is Williamsport, correct?
Yeah, right.
Outside of Williamsport proper, what kind of health services are available? Like, for example, doctors and different, let's say, 24-hour centers, or.
Yeah.
I was just curious how that played out in your community.
We have 2 major health systems that sort of compete with each other. One of them is UPMC, University of Pittsburgh Medical Center, and the other one is the Geisinger Health System. And really what's happened is that, I think, and this has happened across the state, is we've seen these health systems try to compete for market share, because a lot of them are vertically integrated, meaning that they're providing not just medical services, but health plans. So they want to try, this is my experience and just me speaking, but what I can seem to understand, we had 4 hospitals that were part of the Susquehanna Health System. And the health system decided to go with UPMC. What I find interesting, it was never really a public debate about it, which I think maybe there should have been, because these are based hospitals. But the health system decided to go to UPMC. And, UPMC now, a lot of decisions are made out of Pittsburgh. Obviously, they're not making staffing decisions, but we kind of are getting the feeling that a lot of decisions on money and so forth are made out of Pittsburgh. Geisinger just built a new health system in our county, a new hospital in our county, a 25-bed hospital. And again, I think they're trying to compete. We have a pretty good share of health services. We also have MedExpress. Geisinger has an urgent care facility in the city of Williamsport, and the hospital. So the UPMC has 4 centers, and one of them is out in Muncie, which is about 20 miles from Williamsport. And Geisinger also put a facility out in Muncie. Like you, our population is aging, and so there's a big competition to get these aging folks, on the programs, whether it's a Medicare program, et cetera. So what we found was that we had sufficient health services. One of our concerns was, and the employees' concern was, well, are you going to be able to get good quality people to work in the health center? What we found is that there are doctors and nurse practitioners and nurses and nurses' aides who don't want to be in a health system where they may have X number of patients they have to see. I don't know about yours, but I think our hospital now, over half of the doctors are employed by the health system. And so the whole system of healthcare in our country is incredibly driven by money. I mean, when they came in, when UPMC came in, they put up $500 million to acquire our 4 hospitals. And I think 250 million was in debt that they were assuming, and 250 million was going to be in new investment. But you're talking about, you know, the whole health system is very, very money driven. And what we found is Integrity was able to go out, and this is, I think, one of their strengths. They were able to go out and find people who were really good doctors who went to medical school because they cared about wanting patient interaction. When we go to the health center, you might be there 45 minutes. No one is telling you, okay, sorry, you got to go, bringing in the next person. And so I like that, because what we're trying to do is to get our employees to focus on their own health. And to do that, they need someone they can build a relationship with and have, it's all confidential. Obviously, the commissioners, all the HIPAA laws apply. We have no idea who goes there, what they go for. But what they're able to do is develop a relationship with healthcare providers in a way that, whether it's behavioral health or whether it's physical health, they're able to get to the root cause of problems. And that, to me, is what helps drive down the cost of healthcare. And again, what I started with was this whole idea of changing the paradigm in the way we think about it. Instead of focused on getting our premium down, instead of somebody telling me we're raising your premium 10% or 8%, it's how do we keep employees healthy? You know, if I want to just add parenthetically, if I run a high turnover operation, like if I'm doing a fast food restaurant, I'm going to try to find the cheapest plan I can just to comply with the law that I'm required to provide health insurance, because I'm interested in keeping my costs down. But when you're in an organization like we are, with people stay 25 or 30 years, you want a health system. I want a health plan that's going to focus on keeping people healthy, because ultimately, instead of paying in year 15, I may not pay at all. So that's what's helped me understand about how we can. But we've been able, here's the other thing, they recruit all over. We've been able to attract people from outside the area to come to work in the health center because they're on a salary and they're not being checked, 15 minutes, 20 minutes, get the next patient in. So anyway, that's just been our experience, but it's been a positive one.
Could I piggyback a second question to you?
Absolutely.
All right. You mentioned employee participation, and I think we're both aware that the success or failure of this project or program is really all about the employees. It doesn't matter what we want. It's going to be what the employees do. And now, so I guess you may have it. I know employees, you mentioned the HIPAA, which I think is important, because employees are always fearful that the employer, be it the county, is going to be involved in their health care. And I know for a fact that they are concerned about that. Have you found, since this started, that the employee participation has increased? Because it is voluntary. I mean, you're still running, I would assume, a traditional plan alongside this. So have you seen an increase in employee participation in the health center?
Yeah, absolutely. I mean, I was surprised that we haven't been open that long. We've only been open a couple months. I was shocked that we had seen so many people in December, because we've been getting very positive feedback. And one of the things that Integrity Health did was they came to educate our employees. They didn't just, they came multiple visits and small group visits with departments to try to educate people about the fact that it's voluntary and the fact that it's confidential, and also help our employees understand their relationship to the healthcare system and how their participation keeps them healthy. I mean, look, at the end of the day, we are trying to save tax dollars, but we also want people healthy. we don't want people to have heart attacks at age 59 or to get cancers and stuff like that. I mean, I think all of us go into government to try to do something positive for people. And I think people understood that. I think employees understand it. And I mean, I've gotten emails saying, we took our son there over the weekend and it's been absolutely fantastic. And, thank you. We use it as a recruiting tool now because we understand that we have something that sets us apart from other employees. This health system is only for our employees and retirees. It's not open to the general public, the health center. And so it means that our employees are getting like top level care and feedback. I love my doctor, but I've been to my doctor sometimes, they'll draw blood and I don't hear back from them. And maybe they're not calling me because there's nothing wrong with me, but when I went down there, I went to the health center. I had like a call the next day. We're checking in with you. We did this. This test is fine. Everything's good in your blood. We're going to check in with you again. I mean, that's the kind of service in healthcare. It reminds me when I was a kid growing up. You may think this is a weird example, but you went to a gas station. They pumped your gas and cleaned the windshield and gave you something for coming to visit them. I mean, this.
You may be older than me, I don't know.
Yeah.
Well, let me just say thank you for answering my questions, and I appreciate the fact that you understood my questions. I've been accused of not being very clear, but I think you're right. I am concerned about the health. I think we're all pro-health, and I think our system, our for-profit healthcare system, is on a one-way track to disaster until something is done, or probably, as usual, the governments will wait until it's a disaster. But I agree with you that the for-profit system, it's just constantly going up. And while I'm personally hesitant to expect anybody to be able to control that cost, but I mean, you've made some interesting points. And I since you've experienced it, I appreciate your information. Thank you, Commissioner.
You're welcome. And you know what I think? I think that like many things, we're all going to have to make the changes at the local level. I was in the state legislature for 6 years, and you try to make changes there and so forth. But what I realized as a county commissioner is that, maybe we're not rocking the entire universe, but what we're doing is we're making some changes for the lives of these 700 people that's going to be positive. And we're also paving the way of trying to get control of healthcare costs. And sometimes I think, after doing this, I'm 66 years old, and I've been doing a lot of different things. And I've come to realize that sometimes the things we do on a day-to-day basis in our counties and so forth makes a lot of difference. And I'm going to have questions to ask you all on problems in the future, whether it's how to run our prison more efficiently or other things. And I hope to be able to reach out to you to get your experience,
Anybody else got any questions? I have one. How long has your center been open? Because you said you only been open shortly.
Well, we've been open a couple months, but it took us a while to build it because what we did is we built it right in one of our own facilities. So we're not paying rent to anybody. We had excess space in one of our facilities, and of course, we had to contract it out, and we had, there were issues around COVID and so forth and supply chain. So it took us a little longer. Honestly, we spent a lot of time on that RFP, and in retrospect, I think we kind of lost time that we could have just been moving ahead, but that's live and learn. That's what happens. But what I'm excited about is the way the employees have embraced it. And part of that is that it's voluntary and it's confidential. That is important. I mean, I have no more business, and no one in the organization would release healthcare information any more than they would if I went to the hospital and said, hey, I'm a county commissioner. This person's on our health plan. I want to know about their health. I mean, it doesn't happen. And I think the employees understand that.
Okay, just following, this is Commissioner Myers, just following that up with that question you had there. You said you're also doing your retirees. Is that how you expand it out?
Yes, because we, I don't know whether you do, but we had we cover health care for our retirees. Now that was changed in 2014, and anyone hired after 2014 is no longer covered. And that's something we're grappling with, because now we have some people working next to other people who get that benefit upon retirement, the others don't. And, you know, we kind of have struggled with that. But what we are doing is the retirees who have that as a benefit are able to use the health center.
Okay, just to follow up, 2 follow-up questions. Is this thing centrally located, and what hours, what are the total number of hours of operation are you guys using?
Well, you know, that's a good question, and I'm not sure I know but we're basically open all day till about 6. We allow, now this is new and we're trying to sort it out, we allow people to go on work time if it's reasonable. So for example, if you're sick and you think you're coming down with the flu, you know, you say to your supervisor, listen, can I go over to get checked at the health center? You go on work time, you don't have to take personal leave time. Now, if you're going to go, to give you an example that you can't go home, drive 25 minutes, pick up your kids, bring them back, take them home, and you're gone like 2 or 3 hours. You can't do that, right? There has to be some reasonableness. But part of what we're trying to do is to get people accustomed to it. And I mean, also, if someone has the flu or COVID, we don't really want them around everyone else, right? We'd rather sort of, if we had the health center during COVID, we would have been in incredibly good shape, because we could have done all our testing there. We could have been much more proactive in contact tracing and so forth. But yeah, to answer your question, we have weekend hours and we have hours during the day. And we are right on, most of our buildings are downtown Williamsport, so the majority of our employees are down there. Does that answer your question? Like, it's within close proximity to us, to all of our employees.
Yeah, it does. Nobody else has any questions? You can let them know who you are. Go ahead, JP.
Commissioner, one quick question. You said you did your build out inside your county facility. Do you remember roughly how large the facility space was and how much you spent in construction? And then how much, the big question for us is, did you spend on like the equipment, like the x-ray machines? And if you could describe of what type of equipment you guys ended up going with, that would be helpful as well.
Okay, so just so you know, like, as commissioners, we didn't go around and look at the x-ray equipment and stuff like that. What we did do is, obviously, I think it ended up costing us close to or a little over $1 million. Now, you might think, wow, that's a lot of money. But our top 10 claims alone, we probably spend $3 million or so a year or more. I'm just trying to look at my notes here to get you square footage. I don't know if I have the exact square footage, but Integrity can go over with you all of the, like how much space you need. You have a lot more people than we do. I mean, which is great, because the more people you have, the more opportunity you have to save money. We are about half of a floor. We might be about 10 or 12, 15,000 square feet. And I don't want you to quote me on it, because I don't want to, but I can tell you that we followed all the state regulations we have to follow in doing the construction, putting it out to bid and so forth. And Integrity, had staff and architects who helped us do that. I'm just trying to see here if I have, primary care was about 8,924 square feet. So it was actually a little smaller than I thought. By the way, one of the things I didn't mention is that Integrity, if you have a more serious problem, they develop what they call a green circle, which are basically all specialists in the area who they can refer people to. And you might say, well, why do they, how are they able to do it? Well, what they do is they contact specialists and they basically say, listen, we can get you exposure to X number of employees in the county health plan. And also we can get you paid promptly because the county's going to pay you. And they're not having to negotiate agreements that they often do with either health systems. So if you need to see a specialist, they can help get you referred to a specialist. Obviously, you can go to one of your own choosing. You don't have to go. That's the key thing with employees. You don't have to go, but you can go. So did that answer your question on the size of it?
Yes, that
Yeah.
answered the question. Thank you.
It's not, we explained to the public, the public was like, well, you're going to spend $1.5 million building this. We explained to them that, look, we spend a lot of money on healthcare, and we need to find a way to reduce our total cost. And doing this, we are confident it's going to reduce the cost, and it does, in fact.
No one else has any more questions? Does that conclude your report, Mrs. McClure?
It does.
I thank you for calling in and giving us your information, sir.
Hey, thank you, and hope to see you down at CCAP.
All right.
Y'all take care. Yep. Bye-bye.
Bye-bye. Now I'm on. We're going to move on. Whole business public hearing on the ordinance entitled, an ordinance for Northampton County Council authorizing the County of Northampton, Eastern Pennsylvania to lease approximately 2,400 rentable square feet of space at 31C West First Street, Wind Gap, Pennsylvania for Joseph Depew. This ordinance was introduced by Mr. Brown and Mr. Giovanni. Public hearing will be held as advertised. We will not be voting on that. If there isn't anything else, let's move on to new business.
Hang on a second. Got to call for the public.
You have to ask the public.
If there's anyone from the public who would like to chime in or make a statement about the public hearing on this? Fellow commissioners, do you have anything to say about this? If not, we can move on?
Yes.
Okay, let's move on to new business. The introduction of, and we will not be voting on executives' appointments for reappointments as well for district attorney request resolution will be held on February 2nd, 2023's meeting. Anybody have any questions on that? Or, yes, Mr.
I don't have any questions. I just, want to offer an apology to the problems and the delay that this is going to cause the district attorney's office, the appointees, and the execution of this lease. We should do better next time. That's all I had to say. Thank you.
Anyone else? I'll talk about it later before we end the meeting. Is there any other new business? Mr. Heckman.
I'd like to make a personal appeal to Mr. Dertinger. Could you please have somebody fix these lights up here? It's like the old disco days. We got a strobe. I mean, it flashes on and off. So it does it. There's no rhythm to it. It's like when Mr. Cusick dances. It's just all over the place. So it's just an appeal. Thank you. That's all I had.
Okay. I have a question for you, Mr. Dertinger. Am I hearing it correctly that our 911 station is going from analog to digital?
For a large portion of it, we have been digital in the Bethlehem area, and the P25 expansion that we discussed as part of the ARP money would be what makes that happen. And that would be bringing about 80% of the county to be available as digital. There will still be, the analog will still work. So this is not a call to all the municipalities that they have to change out their equipment, just that our equipment now will operate digitally and provide us greater bandwidth and much better penetration for areas for service.
So they'll have access to both. So at
Yes.
some point, we will eventually all be digital?
Well, anyone buying new equipment now has pretty much been under the circumstance of buying P25 enabled radios, anything new moving forward. So anyone buying new equipment would be buying things to work on the P25 directly rather than the 800 megahertz.
And the smaller
500.
ones, are they going to be able to get grants if they need to update theirs, the smaller or EMS services and fire departments?
I believe there are elements of that nature available to them. I'm not clear entirely as to what they would need to do.
Okay, if possible, could you get an answer for that from me? Because that was actually, I got a phone call on that earlier about that today, and I was just going to ask about that. If we can get access for these folks that might need help paying, if they want to do update to a digital program. But thank you for your input.
You're welcome.
Kevin?
Mr. President, this probably should have fell under old business, but probably new business. At the last meeting, I heard what I consider the two most knowledgeable people on this board, Mr. Kusick and Mr. Heckman, seem to have, and maybe I misunderstood it because we listened to this on the phone, but seem to have difference of opinion on whether the health center needed to be bid out or if the executive could pick somebody and move forward that way. So we had two different opinions, and I respect both of these guys. They do know the Home Rule Charter. So what I'm asking is for the solicitor to give us his legal opinion on whether this health center needed to be bid out or if the executive has the right to select somebody. So I would like your legal opinion on that, because we have two very intelligent council people here who seem to have a difference. And so I need to kind of feel comfortable with that, even though it seems like we're past it, but it doesn't seem like we're past it. So I'd like to know that.
Yes, you could.
I sent a memo out on the 10th. Did you see that?
I don't believe so.
It's on your desk.
Well,
Yeah, but I don't believe that answers the question I'm asking.
well, currently, the ordinance says that they cannot spend any money on the healthcare center.
That's not my question. My question is your legal opinion. Does the health center have to be put out to bid?
I'll have to get back to you on that. I need to look at that.
That's fine. I'd like a legal opinion on that.
thanks.
Thank you.
Mr. Myers,
Yes, sir, Mr.
I just want to tell Mr. Kevin in fairness, my position, and I'm sorry if I confused anybody, I do apologize to anybody. I was reading our ordinance and the responses the executive had sent back when he sent the ordinance back. My understanding, and I like you, I'll let our lawyer do his due diligence. My feeling was, and I don't know about, I can't speak for Mr. Kusick, I believe that as the charter, as it stands, gives the executive the right in this type of a program to give it to whoever he wants under, I think, 1301 or 1310. 1310? Yes, 1310.
It's the administrative code.
Yes, the administrative code, I'm sorry. I believe, I think what I hope I said is, I believe he has the legal right under our codes to do that. I did think, though, that it would probably have been better, given, I don't believe in sure things other than our own mortality. So given the seriousness of the proposal, that I believe it would have been better to have bid it out. Ultimately, he can pick who he wants. I mean, Mr. Brown that's my take on the charter, but we have a solicitor, but that's what I meant. I was sort of saying two things, and I get that. I think he has the right to do it. Whether he should or shouldn't do it, that's another matter that you'd have to talk to him about. But that's what I meant.
And that's exactly the point. I mean, we all have our opinions, but I want a legal opinion. It doesn't really matter what I think, quite frankly. It's what the Home Rule Charter dictates is what counts. And so that's what I'm looking for. Thank you.
It's a clarification. It's not really in the Home Rule Charter. It's an administrative code.
Administrative code.
Yeah, I know.
We're good.
You do understand what I'm looking for.
Yes, sir.
Thank you.
Mr. Goffredo.
Does the ordinance overrule the fact now, though, that we would now to have council input with regards to any decision being made, whether or not we want to bid it out to multiple entities? Or does that ordinance not state that specifically?
I'm not sure I understand the question. If you could do it again.
After the ordinance has been passed, do we now have the overall say whether or not it goes out to bid? Or is that still up to the executive to decide?
No, I think that's the question for Mr. Lott in reference to whether bidding is required. Or is the executive permitted under the administrative code to pick and choose?
And I am outside that ordinance. I'm not.
Yeah, so that's why I guess I don't know if we're asking the same thing.
Yeah, that's, I'm
Are
not.
you asking about what the home rule charter stated before that
the
ordinance, or what it
administration
states,
code, but
The charter's not,
or the administrative code? Or are we asking how it stands now with the ordinance being passed? Because I kind of thought that was the point of the ordinance, was to keep the council kind of more involved with that decision-making.
I looked at this previously, and I don't want to
we can wait.
forestall my opinion, but one of the things the administrative code says that the following: the method of non-competitive bidding that's given to the executive shall not be used as a substitute for a competitive procedure if a competitive procedure can be reasonably used. Now, that's subject to interpretation. That's what it says.
As most things.
So I'll give you an opinion.
That's what I'm looking for, thank you.
Yes, sir.
And I think you're right, John. I think you and I you're saying after the fact, I was saying before the fact of the ordinance. Thank you.
anything else on this subject? Can we get back to new business? Is there other new business for tonight? Then if there isn't, council reports or committee reports?
We had a finance committee meeting yesterday, and we had the controller reports, and the airport authority came in and gave a presentation, and we have the information. Everybody's received it. So if you want to review that, and that's all I have on that.
Any other committee reports?
Yesterday, we had a personnel committee meeting, the fruits of which we will vote on February 2nd.
Thank you. Liaison reports?
I have one. Discover Lehigh Valley met on January 10th, the board, and I think, again, things look good for the Lehigh Valley in terms of our hotel occupancy. We're top in the area and in the state, and things just look better and better. There was a review of the budget, and there was a review of their marketing program, but I think that we're back to pre-pandemic levels, so things look good. So that kind of goes along with the report we had from the airport authority yesterday.
Anyone else? One thing I want to add to this liaison report, so we need a conservative district liaison for the second Tuesday, 7 p.m. in Greystone. If anyone wants to consider that, please get back to Ms. Zembo or myself and let us know if you want to fill that seat. That's what we do not have at this point, and that's what we need to do to round out our liaisons. For the conservation, okay? Conservation District, okay? All right, clerk's report.
Just to extend my apologies to the members of council and to the administration for the error that was made yesterday.
Solicitor's report.
Two things. One is I'm the master of the obvious. We should state on the record that no action was taken this evening, number one. And number two, I'm just recalling in reference to Mr. Lott's request. Previously, I obtained, and I don't know if I shared that with you, the RFP from Lycoming County. Did I share that with you?
Yes, we all got that.
Thank you.
Is that it for your report? This is
Yes, thank you.
With that said, actions have been taken to correct the unfortunate thing that happened for today's meeting, and we'll move forward with it. If there's anyone at fault, it stops with me because I am the president. I'm the one who has to I will take the hit for this because it is my responsibility as your representative to make sure things run smoothly. With that said, we are going to move on and ask that we adjourn. Formally.
Are we allowed to adjourn?
Motion to adjourn. Second.
Second.
All those in favor? That's just a permission. See everybody